I'm 72 years old, so I've been probably going to my primary care physician at least once a year since 60, and getting certain checkups as far as heart, cardiologists, urologists, colonoscopies, trying to keep up with my health being 72, trying to stay as fit as I can so I can lead a comfortable life and maybe a long life. There's better communications now between the doctors, and especially now with the computer age, I go to my primary care and everything's there on the computer, and my visits and so forth, prescriptions if I'm taking any. So the communication has improved greatly, and I think that's one of the benefits that the ACO is providing, communications.
More focus on number one, preventative care, which is critical. Number two, a more holistic approach is really something that I think the ACO really will have the physician look upon. So we don't provide episodic care. So we need a team-based approach with nurses, with allied health professionals, with the physicians, so you can really provide an approach to patients that gets them healthy before they get sick.
We're able to manage our patients more efficiently and be able to follow them more closer. We have a more complete medication list on each patient. We have their background history better because of the fact that the information is easy accessible and can be shared with the hospital and with specialists.
As member of the ACO, one of the best things that it will be integrating all our service and with other physicians, and that way we can kind of just coordinate the better care for the patients.
What we're really seeing right now is a different level of engagement by providers and by patients in taking care of improved health. So you're going to see patients that are much more willing to ask questions, to be transparent about the care that they're getting, and you're going to require providers who are willing to work more collaboratively, not only with physicians, other healthcare professionals, but also with their patients, to really form teams to get the results that we're looking for. The hospital, I think, is going to continue to be central in our communities, but we're seeing more and more care move into the outpatient setting, into the home setting, into self-care management, into models that revolve around teams of professionals, primary care physicians, specialists, and other healthcare professionals. So I think the ACO is really that vehicle as we begin to watch this transformation of care into really a healthcare community, not a hospital community. It's really our responsibility to be out there trying to find solutions. And getting and developing the ACO was part of that responsibility to say we are going to participate in the changes that are happening in this country. And in fact, we're going to participate in finding the solutions. And so that really allowed us to jump into and form the ACO. The ACO is really the vehicle to allow the discussions and dialogues and collaborations that are necessary between hospitals, between long-term care facilities, between physicians, between other healthcare professionals, patients and payers, to beginning to find ways to do what we do better, to serve the patients better, to get better outcomes, and to reduce unnecessary costs, and to deliver better value in our system.